Hello mates. Just because your patient's denture is retained by implants doesn't mean you shouldn't understand how to set denture teeth. Lingualized occlusion is easy to do, as this video will demonstrate. You can use just about any teeth. And waxing a denture doesn't require the services of one of the old masters. Yes. Mr. Cooper, you had a comment?
Jay, dentists don't do this sort of thing.
Well, Mr. Cooper, it's important to have a basic understanding of what the tooth setup you requested should look like. You should make a reasonable request of your dental laboratory, and they should provide a reasonable result. The best way to learn this is to actually set a few teeth. Today we'll look at setting the anterior teeth. As you might expect, a few caveats need to be mentioned. The video demonstrates tooth setting on a school teaching model. Students were given specific guidance on how to construct the wax rims. Teeth were set on a flat plane, and a 5-degree inclination of the guide table was employed to account for an inaccuracy in the use of the mounting table. Here's what the setup looks like. Let's go over some of the basics of this particular lingualized setup. One really important concept to understand is freedom in centric. The case is mounted on the cast with a retruded jaw relationship. We will set the condylar inclination at 0, as well as the lateral at 0. The cast is mounted with a flat mounting table. If we then restrict the patient to this position with our tooth arrangement, the patient typically will complain of not being able to wear the denture. So, in the anterior we set the teeth with no vertical overlap, and about 1 mm of horizontal overjet. The anterior teeth will exhibit only brushing contact in excursions. They should be able to bite a piece of lettuce. Okay, let's look at how this works. The teeth are oriented to touch the occlusal plane as defined by the wax rim. The central incisor is placed at the midline, with the incisal edge touching the occlusal plane, with no angulation. The lateral incisor is placed with a slight distal angulation, 1 mm above the plane. The canine is placed with the tip on the plane with a slight distal tilt. The canine is rotated towards the distal. It should be placed in such a way that one cannot see the distal one half of the tooth while looking straight on. The neck of the canine tooth is rotated outwards towards the buccal. The tip of the tooth rotates inward. Neck out. Tip in. On the cast we estimate the center of the maxillary residual ridge. We mark this on the anterior of the cast. The distal of the cuspid parallels this line. The incisal edges of the teeth conform to the curvature of the arch. Okay, let's watch Junior Poser set teeth. If he can do it, anyone can.